My next guest, Dr. Tom Forfa, is a dedicated physician and an educator on a mission to bring 1,000 men out of osteoporosis by 2026. Dr. Forfa has gone from fracturing bones to competing in his first powerlifting contest and returning to the potentially bone-breaking activities he loves, like snowboarding. After successfully reversing his own osteoporosis naturally and drug-free, his mission is the same: to help men do the same as he has done. Tom, can we please start with your mission?
My mission is to make osteoporosis a truly reversible drug-free condition.
Well, let's just say that it actually is. It's the goal is to help others be aware of that fact.
Exactly. Right? Yes, exactly. And honestly, I don't even see it as a disease for myself. I see it as a condition where we can, like with muscles, as they get weaker, we can strengthen them. And the same thing with the bones. And so it's not a disease per se, in my opinion. There is no virus, or there's no bug that if you take that out, the bones go back to normal. We need to take the actions to get them there. And it's all within our grasp. It's all within our reach, and it's doable. And I guess I'm here as a man because I've had osteoporosis myself, and I've got a background as a physician. So my story is a bit different than what most people may have heard in the osteoporosis space. It is understandably mostly affecting women. And Debbie, you're doing an amazing job getting that message out to women. And then there's also a percentage of men who are going through it as well.
Yeah, I think it's like 20%. Isn't it like 80-20?
Yeah, it's about 80-20. But when we look at the percentage of hip fractures, 25% happen in men. And when we look at the statistics of the men who get hip fractures, 1 in 5 pass away in the first 12 months of having that hip fracture, which is worldwide. That's far more than for women in terms of how many men pass away as a result. So it's quite drastic in terms of the mortality as a result. And in the medical system, unfortunately, men are often underdiagnosed and undertreated when it comes to osteoporosis. So I'm here to change that and change how we look at men's osteoporosis, but also help men and their partners and their wives understand that it is something that can be changed and can be improved. Like for me, for example, when I was diagnosed, it was a pivotal point where now, 4 years on, I'm in the best shape of my life. It was a turning point for me personally. And in a way, there was a silver lining to the whole thing, which we can get into as well. But it's turned out to be actually a positive thing, the way that I kind of approached it in the end.
Yeah. And I think, so I definitely want to talk about the silver lining. The thing is we're just doing it all wrong. And the fact that word disease, like you said, it's the negative 2.5 on a DEXA that tells us it's a disease. The ironic thing is, as we age, we see in ourselves wrinkles and a change in the way we look, right? I'm late 50s. I do not look like I did in my 30s, my 20s, and I accept it. I don't like it, but I'm accepting it. Yet we are trying to compare our bones to that of a 30-year-old. So why are we doing that and thinking that our bones should be that? So to me, the whole problem begins with the way we're diagnosing or what we're looking at in the first place, because we're not even looking at our bones correctly. We're looking at density, which is not an indicator of fracture risk. It's not. And so we have to look at the quality. And so we're doing it all wrong to begin with. And that brings up a whole bunch of fear and lack of knowledge. And it's that to me is what really needs to shift is all of that, which is why I think you kind of came to that silver lining. So then you had to go into the, what do I do? But just tell us about your story, because it's not typical for a young man to be diagnosed.
Yeah. So taking it back to COVID in 2020, in between lockdowns, I went for a bike ride. And I'm going for this bike ride, and I was almost at a standstill, and I stopped. But the front went into a ditch, and I slowly went over the front, and I landed on my wrist, and I broke my wrist. Now, on its own, not necessarily an osteoporotic fracture, but when you look at the grand kind of the big picture, that was my third fracture in 18 months. Before that, I rolled my ankle and I fractured it. And there was another one where I was doing some boxing. I'm very active, and so I was holding a pad, and someone punched me through the pad and broke a rib. It was a very thick pad. And you put all that together, I went to my GP and I said, something's not right here. And this is actually off the back of multiple fractures, ribs, another ankle. I rolled an ankle and broke it in 5 places. So that was both ankles broken over the previous 10 years. There was another wrist. And so I went to my GP. I said, something's not right here. He did the DEXA scan, and sure enough, osteoporosis in my lumbar spine, osteopenia in my hips. And I was, other than otherwise healthy, 37, maybe 38-year-old, I think it was at that point, male, which was a surprise. And I went to my endocrinologist, and he was probably more confused than I was. I want to make of that. And he said that, all the studies are on the postmenopausal women from Japan or Europe, and there's obviously a lot more than that. But he was kind of at a loss, scratching his head. He took the traditional medical approach to it, and that was good in the sense that we did the blood tests and all the different tests to try and find a cause, and we found nothing, no cause, which ultimately for me was a bit of a green light. When we talked, I've got a bit of a system as to how to think about osteoporosis, particularly in men. And if it is what's called idiopathic, so there's no particular cause, it's a bit of a green light to start building bone. And it's a bit different in men than women, because men often have secondary osteoporosis. So the cause is important. But anyway, we figured out that there was no cause, and he said, cool. He told me I've got 2 crush fractures in my lumbar spine, which that was a real shock for me. That was kind of when the whole kind of thing started to unravel. I really kind of started to doubt my own body. That's when the fear kicked in. When I got the diagnosis, I thought maybe I could get through this. But then when I was told that I had the fractures in my lower back, I started to think, what was everything that I'd done over the many years of looking after myself for nothing? What's going on here? And that fear kicked in, as you said, Debbie. I wonder, was I going to break my spine again? Was it going to get worse? Was I going to end up in a wheelchair? All these different things were going through my mind, and so I was kind of at a loss, and I started to look into the situation, because I have a background. I was a physician. I left the profession many years ago because one of the reasons was I became disillusioned with the way that things are being done in that system. But nonetheless, I was able to use my medical knowledge to go, okay, I'm going to do a deep dive into this. I need to fix myself. I need to understand what's going on here, and something's missing. Something's not making sense. All the doctors I spoke to, they were saying that they kept saying to me, you don't lay down new bone after 30. That same phrase, which it sounded very strange to me. It's almost like they'd all memorized it, or it was like this catchphrase that they were all using. And it didn't make sense, because I knew I'd broken many bones and laid down new bone after I'd broken those bones. And I knew that I'd strengthened my forearms were very strength, because I was very physical with a lot of different, boxing and push-ups and things like that. And so I started to dig into it. I used my background as a doctor, and I went to my endocrinologist, and he said, Tom, I think you should take the medications. I think you should go on the injections. And I asked him if I could have 6 months to do it on my own. Give me 6 months to try this out. And he said, Tom, because you're a doctor, I'll give you that 6 months. I put together a bit of a plan, got together a team, and I went at it. And then 6 months later, went back to him with improved scores. And I kind of I slid the paper across to him, and I kind of sat there with a big smile on my face, expecting like a big thank you or well done. And that, but nonetheless, I decided that I'm going to not just get myself back into, I still look at the T scores, and I look at also the bone quality, as you were saying, Debbie. And I still want to get myself into the normal T scores, just because I know that the whole medical system is still in that mindset. And if I can speak to them, speak their language, we can start to shift things around and kind of bring them along on the journey of bone quality as well as density as well. And so my mission has been kind of started off to just kind of get myself back to healthy bones. And along the way, I started sharing what I've done, and so many men just thought, you know what, I need that help too. It's very confusing as a man to be diagnosed with osteoporosis, which is often seen as a women's condition, which, to a large extent, the vast majority is women, and understandably, we need to do more in that area. And at the same time, the fellas that get in there are just so confused and wondering, where do I go? And so I decided, you know what, let's kind of chat to these guys and see, what can we do to help you? What do you need? How can we support you? And we've created a bit of a community around that.
Yeah, so amazing. So before we even get there, because you just had so much to say there, I think we
Yeah,
should
so
say
much.
here, people always ask me this, why is it more a woman's disease than a male disease? Now, and you mentioned primary and secondary osteoporosis. So just for clarification there, primary osteoporosis is usually the loss of the steroid sex hormones, estrogen and testosterone. It happens in women postmenopausal. Like that's usually the number one cause, the primary cause, right? That's 20% of bone loss, up to 20% could be lost during that time. 5 to 7 years postmenopause, greatest decrease in bone density. So that's primary. And then the secondary are all the other things that could be involved. The reason why I've heard, and I don't know if if you could clarify if I'm right about this, is that the reason why there's not as many men diagnosed with osteoporosis is because they have larger bones. So the DEXA scan is going to give a better result. And that's our diagnostic up until now. And men don't typically lose testosterone, which is bone protective, until
Mhm.
about age 70. So those are the two reasons why I heard that men don't typically get osteoporosis. Is that correct?
Yeah, that's correct. It is the men don't have as much estrogen. Estrogen is osteoprotective. That is a big part of it. And once that goes post menopause, that is the biggest cause of it in women. Now, men don't have that as much, although to a certain extent, all the talk about testosterone is because it does get converted into aromatized to estrogen, and that does have an osteoprotective component. But at the same time, the testosterone is protective of the bone because it does create stronger muscle mass, which then puts pressure on the bone and strengthens the bones. But for men, there is I've got a report of the 28 potential causes of osteoporosis in men, but the common three are, yes, testosterone loss or hypogonadism is one of the large ones. There's also Cushing's syndrome, where there's a high amount of stress hormone or cortisol in the body for a long period of time. And that could be because of something going on in the body that's creating that, or it could be because we're taking the glucocorticoid steroids for different conditions like rheumatoid arthritis. And the third common reason in men is excessive alcohol consumption, unfortunately. But they're the most common ones, but there's 28 potential causes. And it is important for people to work with a physician to try and for men particularly, to try and narrow down what that cause is, because that is one of we have a stop bone loss protocol, which is essentially a triangle of three components to help men firstly stop their bone loss. But that's kind of, we've broken it down into steps, because sometimes it can feel overwhelming to go, okay, I need to get my bones back to complete health. So we've broken it down. All right, let's first stop the bone loss, show you that you can do this, that it's possible, develop that confidence, remove a lot of that fear, and then we can go from there. And so the stop bone loss protocol, the first component of it is to remove the obstacles to strengthening your bones. And for men, one of those is identifying the potential causes. So working with a physician is really important because there are a lot of blood tests that need to be done to figure out what that is. And it's a whole array of things.
Just give us a couple of those. Because here in the States, we look at CTX, right? That's and urine DPD and maybe urinary calcium. So there's a certain markers that are looked at here from a traditional perspective, not functional. Functional medicine kind of goes into other areas. But what is it that you're looking for in Australia when you're looking in your serum?
So I like to think of it in terms of the conditions rather than the specific tests, because it'll vary depending on the individual's history. Having a conversation. So there could be chronic kidney disease, that could be a cause, liver disease. There could be different. It's a scary topic, but different potential cancers. It's a rare one. It could be one of the large causes or main causes for men is, in fact, prostate cancer treatment, the anti-androgen treatment which drops testosterone. And a lot of the men that we speak to, they don't realize that. They say, 10 years ago I had treatment for prostate cancer, I'm fine, but I've had this osteoporosis for a little while now. Do you think that might have something to do with it? Most definitely, yes. We're also looking at different absorption problems as well. Celiac disease. I know, Debbie, you're very big on gut health, and that is an incredible part of this for men as well. For myself personally, I'm gluten intolerant. That was a big cause of my osteoporosis, long-term chronic inflammation. And so I wasn't absorbing. And so I like to break it down into kind of three main kind of components. I call it the triple threat. Three different reasons why men could get osteoporosis. So problems absorbing the food, because as the saying goes, you are what you eat, isn't quite correct. It's you are what you absorb. And it's also you are what your food eats, but we won't get into all of that as well. So problems absorbing. If you're not absorbing the nutrients, your body doesn't have them to actually build the bone. There's problems, conditions that are taking calcium out of the bone. Hyperparathyroidism, where the parathyroid glands are pulling calcium out of the bones, is an example. Chronic kidney disease is another one. And then there's conditions that affect the creation of new bone. And so I kind of try and kind of conceptualize it into those three areas and then work through all of those so that, we're removing the obstacles to strengthening bones. That's one component. And then the hormones are a big part for men as well. And it's not so much estrogen, it's, testosterone is important.
That's so interesting the way you do it there, because here, conventional medicine, I think that there's such a control here with whoever the powers that be, the structure at which we operate, right? We have to be able to put a code to whatever it is we're looking at. And I think there's been a control of how we manage or look at certain disease states. So with osteoporosis here in the West, or not the West, I don't even know if you're saying that, conventional medicine, we look at general markers, where it is the CTX. And honestly, some of those markers were actually developed by drug companies to test the efficacy of medications they were using. So it wasn't even something we were doing normally. It's because we wanted to see if these meds were working. What you're talking about in your approach, there's a functional mindset there, because here we look for the what, which is osteoporosis. We Band-Aid solution it with a medication that you can go on for a year or 2 years, or maybe then you go to the next one. We don't look at the why here. Your approach is actually going deeper into the why. You're going to next level. Is it kidney function? Is it hormone-based? What's going on? So you're actually doing a deeper dive into what are the root causes, because if you know the why, then you could try to work on stopping it. I mean, doesn't that
Exactly.
seem like we should all be doing that?
I know. This is the thing that frustrates me about conventional medicine. Now, Debbie, I need to tell you, I'm not strictly conventional in my thinking. that's probably why we resonate here, and what frustrates me with every time I go to my GP or endocrinologist, they pull up the guidelines and they go, well, Tom, you don't fit these guidelines, so I don't know what to do. I'm like, well, what do I do in that case? Like, where does that leave me? And and the way that my mind works is to, all right, well, let's, like you said, let's figure out what's going on here. Let's address it rather than just following this template that the powers that be have handed down. Let's think through this. Let's see what's going on. Let's see what we can do about this. And I just don't know why that's just medicine in my mind. That's how I think of medicine. That's good medicine. That's how you kind of work through it and figure out what is the cause. And most often, it's not the solution isn't a lack of this medication. It's, well, you haven't really triggered the bone growth. We haven't done enough to actually force the bone to grow. We haven't given it the fuel to grow. Maybe there is an obstacle preventing it from happening. Maybe there's another condition. Maybe there's something we're doing with the medications for other things that are actually contributing to this. So let's adjust that and looking at the whole picture. Like that just makes sense to me.
I think it would make sense to all of us if we actually thought about it. But up until now, we've kind of put the power in our doctors, where we have so much respect for them. I have so much respect for them.
Yes.
We go to the doctor here, it's gynecologist and endocrinology, and we say, what do we do? Well, unfortunately, the training for the doctor in this condition called osteoporosis is to use this machine to look at it, which could be wrong up to 70% of the time, which is only looking at density, which is not an indicator of fracture risk.
Yeah.
And then there's the pills. So it's just that, like you use the word good medicine right now, what this is called is bad medicine. And so that's what we need to raise awareness to. Now, okay, so you start out with your first, I love it. Shouldn't we be trying to figure out how to stop bone loss if that's what I mean, it makes sense.
It does. And I have some empathy for the doctors as well, because I know where they're coming from, because I've been there, and it is very much, there's time pressure. You know, it's 10, 15-minute consultations. They're tired. They're exhausted. They've got patients upon patients coming and going. They've got their own personal issues going on in family's life and things. And then they've got a patient who they really want to help, but the training has only given them so much, and they're working within these limitations. There's probably pressures to put a code on everything. And they're like, all right, what do I do? And they'll look up the guidelines, and at the same time they're being judged. There is all this, medico legal stuff, and they need to do the right thing. And they're being judged in Australia. The way that we refer to it is, you'll be judged by body of your peers in medicine. So is everybody else doing this? And this is kind of the key here in conventional medicine, is everybody else doing what I want to do? If the answer is no, it's a pretty rough ground for them to go forward at that point. They have to be very careful. And so at that point, they might just go, you know what, I've seen this before. It's, if medications, people don't, oftentimes also patients don't want to do the hard things to strengthen bones. It is there a pill I can take for this? Unfortunately. Or others are like, what else can I do? And then that kind of can open up the avenue to talk about what else is there. And I think you're probably your audience, Debbie, and the people that come to us as well, is they're thinking differently. They want something else. They don't just want the medications, or potentially maybe down the track, they want to try and figure it out and think about it themselves. Or maybe they've done that already. They're sick of it and they want to find another way. And the answer is that there is another way. And the research shows it. And I think it's only a matter of time before, people like yourself, Debbie, are going to change the conversation in medicine so that the doctors see, as more and more of them start to kind of get on board with this, the body of their peers will start to think differently. And once that tide changes, and I believe it will within the next 5 to 10 years, that it'll be very much more of a lifestyle condition, something that, like I was saying at the start, it's a truly reversible drug-free condition, where the first step will be, all right, let's remove the causes. Let's start triggering bone growth. Let's give your bones the fuel it needs to grow. And let's do that first. Are you up for doing that? Patient will say yes or no, and we'll go forward from there. But
Yeah.
yeah,
Okay. So I love to ask this question over and over and over. Is bone loss reversible?
yes, I can't see it how it cannot be. Like it is. Once we remove any potential causes, trigger the growth, give it the building blocks. There's no reason why it can't grow.
And then is osteoporosis reversible?
Now, that depends on your definition, but right, because I think it's not. I think that's probably a deeper conversation on T scores and how we're defining osteoporosis. And I think that we can definitely get out of osteoporosis if we look at it as in terms of fragility and likelihood of fracture and even T scores, but that's becoming less important over time.
Well, so the criteria to actually be diagnosed is -2.5 on a DEXA. So if you're a -2.8 on a DEXA, and then in a year or two or three, you're a -2.4, you have reversed that disease. I know that I've
Yeah,
seen that. And didn't you
exactly.
do that? Didn't
Yeah, I've seen that as well. I guess what I'm referring to is the REMS as well, and the bone quality and the fragility scores that come out. I've spoken to men who have the same or worse T scores than I do, but they have the same or better fragility scores, so their bones are less likely to fracture.
Oh, yeah, and then so you know what that's about then? So what happens there is that back to this lovely way that we are looking at this, at our bones, diseases or not, is the data that is put into the computation of the results that are coming out of the machine from the DEXA and or the REMS, the ultrasound technology. It's the data that you're being compared against. And typically the data that's put in there is of a sicker, unhealthy population. So as we age, especially when women start to get to the 70-year-old mark and above, they're being compared against a much more fragile, if they're a healthy, very active in their own health person, because this is what I talked about. Dr. Bush talks to me about this. And he actually sometimes will move the age of his client because it's not all 70-year-olds are created equal. And if you are a super active, healthy person, then those numbers you're getting year in year that keep going up and up and up, they're going up and up and up because the typical average 70-year-old that's not taking care of themselves is going up and up and up. So this brings us into a whole other thing, which has to do with the data that you're being compared against in that machine. So that's going to change too, I think. I mean, I'm hoping Dr. Bush and I talk about this, that maybe we should have a separate, are you in the A category or the B category? If you're the A category, super fit, active, taking care of yourself, changing your diet, then your numbers would go in here to see what you are, versus somebody that's a little more sedentary or not quite as healthy, they'll go into this other category. And then we would have more of a really definitive or closer to being a more accurate result when we do a DEXA or a REMS.
Yeah, fantastic. Yeah, I'd love to see that.
It's
That would
happening.
create a lot more reassurance than what we have at the moment with just the T scores.
Yeah. Okay. So your program. So from this, is this your silver lining or is this your program? Because we're going to talk about, I don't think your silver lining is your program, although it is your silver lining if you're helping all these men. But can you explain like your approach then? I mean, you did say a little bit of first you want to figure out the why behind bone loss,
Yeah.
right?
So yeah, what we do is it's a mentoring program for men where we start off over the course of 8 weeks, just helping men to understand what is going on with their bones, what needs to be understood, and who do you need to have on your team, and how do we go moving forward. And as I was saying earlier, we break it down to 3 components. Once just a triangle kind of approach. We need all 3 sides, and the challenge that many people have is they'll just address the one. They'll go hard on the nutrition, or just the exercise, or just the medical course, or they'll do 2 of them. But in my view, it's all 3. We need to address all 3, and the one of them is addressing the potential causes of osteoporosis, and secondary causes need to be looked at in men, as well as the hormones. Once we have addressed and kind of looked at that, We also look at triggering bone growth. Now, this is through the right kinds of exercises in the right amounts at the right times. And the key here is understanding what any individual can do safely. Because we're probably in this situation because we fractured things, most likely. And there's probably an ankle or a hip or a back that isn't quite where it could be and where it needs to be able to do the activities to help trigger bone growth. And so we've broken that down into a series of steps as well to help men to firstly build a good foundation of their physical abilities. And then we're slowly going to build on that in terms of activity to the point where we're challenging ourselves. And that leads me, we'll talk about the silver lining. That kind of gets to the silver lining of this condition where it can actually become something really, really positive in the end. And so that exercise component is very important to trigger the bone growth, and then the nutrition to give the bones the building blocks, because we could be triggering bone growth, but if we're not fueling and having I like to use analogies. So it's like constructing a building. If you don't have the bricks, if you don't have the wood, you can have all the workmen on there ready to work, but then nothing's going to happen. And so we need to have the building blocks, and that comes down to the right macro and micronutrients and making sure that they're being absorbed and going to the right places as well. And when we have those three components in place, and that's what we do with our men, that is when we stop our bone loss and we can start looking at strengthening bone after that.
Okay, so a couple of things there. So the first thing, you used the word right exercise, which I love to hear that. I had a hip replacement in my early 50s at 51, and I'm a yoga therapist. I teach classes, 5 classes a week. I've been teaching since 2010, and I've definitely observed thousands of bodies in motion. For me, the biggest thing is that word right. And not necessarily in all the classes that I teach. I teach classes that are not for bone health, but the ones that I teach for bone health, there is such a thing as right, because we want to target specific areas and we want to load correctly. So can you just give me a little, like, what is your version of right exercises? Just some maybe top aspects of what is right exercise, and maybe even, do you have any wrong exercises? Things that you
Yeah,
can exercise
okay.
against?
Yeah, so the important thing to consider is that right is probably different. It has to be safe as well, safe and right. And we often want just like a big answer. Here's the one answer that fits everyone. It's hard to say that because everyone, like I said, is a little bit different. They have different ailments and limitations. So we have to work within people's limitations. But the right exercises for triggering bone growth have to have the right amount of loading, right amount of body pressure. So at least 1.5 to 2 times your body weight, kind of compressing the bones, these are like micro compressions and twisting. So things like jumping, hopping, are the right kind of exercises. Weight lifting is a big one. Things that kind of cause the body to put pressure on on the joints and the bones. Things that a lot of people do that I would say are wrong is just walking. That's not quite enough. It's great for your general health, and we recommend that people keep doing that nonetheless. But when it comes to bone growth triggering, it is about that heavy load and also impact exercise. And I know even when I say that, I get a little bit uncomfortable because I know that not everybody can do that right now. And that's why it's important to have a progression where we build over time to being able to do that. And this is something that I went through as well personally. Like when I was diagnosed, I started seeing an exercise physiologist who she's brilliant, Therese. She's now part of our program. And when I went to her, I started off bending over with just a broomstick along my back. I was deconditioned. I had broken both ankles, and I hadn't rehabilitated them. And so we're working on rehabilitating my ankles before I could even hop on one leg. And then we slowly worked on strength. And then we added more intensive impact exercise, heavier weights. And so we built it up. And now to the point where I'm actually competing in a powerlifting contest in a couple of weeks. because I've continued to challenge myself, and I want to show men that what is possible as well. Right, mind you, two crush fractures in my lumbar spine, two ankles that I couldn't even hop on them when I started. Right, so I know there's a lot of men out there going, "That's great, but I've got this bulging disc, I've got this bad hip, I've got this bad." That's correct, and we need to address that first, and then slowly build up. And so, yeah, I've continued to work on it. First powerlifting contest, I'm very excited and a bit nervous as well. I'm not going to win anything, but I'm gonna challenge myself. And it's one of the things that we talk to our men about is, what is the goal? What is that thing that you want to go back to being able to do? And for me, it was always snowboarding. I've loved snow sports, and over the years, I've fractured a wrist, a couple of ribs, snowboarding, and my last snowboarding trip, it was actually in the US, in Colorado. The first run of the first day, I slipped on the board, fell on my side, and broke a rib, and I was laid up for 5 days. And so that was before my diagnosis. And then since then, I've been able to implement all of this. And just earlier this year, I went on a snowboarding trip to Japan. No fractures. Happy to report, no fractures. I took a couple tumbles as well and didn't break anything. So I've been able to get back to snowboarding, and now I'm powerlifting. And that's kind of the silver lining. I've never been able to powerlift, and I'm actually in the best shape I ever have been. I am relatively young at 42. So even so, a lot of my friends, I can tell you, they're not powerlifting, they're not snowboarding. And, I think that is what is potentially possible. Yeah, it might not be powerlifting or snowboarding, but all our men have something. It might be going back to playing tennis. It might be being able to go do a HIIT class or go skiing again, or whatever it is. Or it might just be not fracturing any more bones. And so we kind of set a target, and we work towards that. And over time, that can become the silver lining, where for myself, it probably sounds a bit bad, but I'm almost grateful that I had that kind of epiphany that I needed to change the course of what I was doing in my life, in my physical health, so that I could end up on a better path.
Yeah, that's amazing. And you know what it is? Because you change your life to a healthier lifestyle. So this was a raised awareness of something was out of balance. I like to say I'm a yoga therapist, so I teach external balance for fall prevention. And as a functional health coach, I teach internal balance. You need that internal biochemical, physiological, metabolic balance to build bones and not dissolve them. And so finding the why, what are those root causes? Is it medications? Is it disease states? What are the factors that go into that? That's you're out of balance inside. What the word dis-ease is out of ease, right? And the body's always trying to get to that balanced homeostatic state. So what are the factors that are leading to that out of balance? And it is multifactorial. That's the thing. It's not just you're a woman, you're getting older, you're losing your estrogen and testosterone. It's what else is going on.
Yeah.
So and that, I'm sure, also when people listen to you, that's another thing they're going to hear that this is not just one thing. It's not because you're a menopausal female or because you had previous cancer, which now you're raising my awareness to. Men that were on cancer treatment also have to raise awareness, because those cancer drugs actually do lead to bone loss. The other big one I see are PPIs or any kind of digestive, right? So you said alcohol consumption. I'm going to say that if we are not managing our life and our stress and we have too much pressure, we might be drinking, which is self-medicating, and or on medications to help manage whatever's happening. So yeah, it's a silver lining for you that you're a power lifter. And it's amazing that at your age, you were able to turn the ship around. And now you show up and you're going to help so many men. I don't know that there's that many men out there supporting men in osteoporosis.
No, I think I'm the only one.
Woo! I'm talking to the guy.
I'm the only
You're
one.
the man.
Yeah, thank you. Yeah, it just makes sense for me as a man who has gone through it. I can speak to the guys and to the fellas who are listening, or to the partners of them. Come on over. We're having a great time over here.
Wow.
It's a-
Sounds so fun. Okay, what about in the nutrition space? So we asked about the exercise piece because the top of the funnel for bone building, you have to eat the building blocks and then you have to exercise, right?
yeah.
That's top of funnel. So what in the food world, are there any foods that the majority of the people you say to avoid? Like, do you have any specific foods, or is it just per individual?
I try to keep it really simple, because most of the guys I speak to, they're not doing much cooking. And they probably haven't done much, although I tend to do that. But we break it down really simply. Protein is probably the one that's missed the most often, as a macronutrient. We're not consuming enough protein, and there are some great studies specifically on men as well that compare men who are exercising and not having any extra protein versus those who are having just whey protein supplements with their exercise. Those men have better outcomes in terms of the strengthening of their bone. So having enough of the right enough protein is very important. And then when it comes to removing things, this kind of goes into the category of removing the obstacles. Like gluten is a big one. I know that's an important part of what you teach, Debbie, in terms of gut health. And dairy is becoming important as well, but although that's a little bit tricky because that's the main source of calcium for a lot of people. So that is an important one as well. And then in terms of the right fats, this is where it gets a little bit complicated, because the conversation around fats can get very controversial, and but it is vital in terms of the building blocks of hormones. If that is a problem for our men, having the right fats does kind of contribute to building blocks for the right for testosterone. And then having enough of the right carbohydrates. Now, this is one that we don't have many problems consuming. The carbohydrates are very they're everywhere. And they can actually be a big problem. Like the sugars are a disaster. But then having the right kinds of complex carbohydrates is going to be important for the types of activities and to have the right types of energy. And it gets a little bit more challenging there, because everyone reacts a bit differently to carbohydrates. But the kind of the overarching main message that I like to get out to men is more protein. At least 1 gram per kilogram, and in terms of pounds, that's about 1 gram. It's about 1 gram per. Oh, I can't do the pounds conversions. It always gets me. But one.
They say that for us. They say about like 1 gram per pound of body weight. I think with kilograms, is it 2.2 kilograms or in 1 pound?
Yeah, 2.2 kilograms. So
then that would mean that we would need, I don't know.
it gets me every time.
We need about 100 plus grams. But honestly, Tom, that is also in my mind something that this is the hot topic right now, is protein. And I like to, of course, I love science and evidence-based research, but what I always say is I question everything. So there's one side where if you have too much animal protein, it could be acidic for the body. And so that could be not great, but we need enough. And then you have vegans and vegetarians that it's really, really hard to have 100 grams if you are if you're not eating animals, and then you might get into too many carbs to get that. So yeah, the protein, it's really where most of the research is right now. And especially because of muscles and sarcopenia and osteo, like bones and muscles, that intricate relationship. And so a lot of the focus now is on strengthen your muscles, because that's going to strengthen the bones. And so the whole protein discussion, yeah, we need more protein.
Yes. And I like to think of it as it is a balancing act, definitely. There are pros and cons to more protein and many of the other kind of things that we do. The way that I think about it is that we are in this acute period of rebuilding bone. And we will be in this acute period for probably 2 to 4 years. doing things that we probably won't be down the track because we want to really get back into or get things rocking and rolling, get things moving, get into that habit. And so putting more emphasis on, the right kinds of proteins for the right individuals is going to be beneficial for bone in the short term. And then we can dive deeper once people have that habit, and we can dive deeper into the different acidity levels and so forth, and get more sophisticated. So, I like to kind of do it in baby steps to get people involved, get people moving, and then we can kind of refine and tweak things along the way.
Now, you said you kinda talked about fat, but you said you didn't wanna go too much there. I just wanna ask, and hopefully I'm not, opening a can of worms here. So, and a lot of people don't understand this. In the way that we've been all wrong about bone health, I think is the same way we've been all wrong about oh my god, cholesterol. It's the same way. We've been really wrong with cholesterol. One cardiologist said to me, it's like, remember in the 50s when we had those bunny ears on our TVs, we would put aluminum foil around it, or we would move them to get like the picture to come in. They say that we're using that kind of technology to look at cholesterol now. Most people don't realize that cholesterol is necessary to make hormones. Hormones are necessary to stay young, vibrant, strong, loosey, juicy, moist. Like, people don't realize that. So when especially with men too, because men then have cholesterol, right? And then cardio, we have to think about the cardiac system here. So what if I don't want to open a can of worms, but I just want to know, like, and I would think with men that might be something. So what are the parameters, maybe top recommendations for fats?
Okay, so keeping it really simple, as closest to the natural form as possible. It's when they become processed, refined, vegetable oils. They get if you can get it out of an avocado, for example. I even believe, out of some animals as well. Some of that is important. Eggs, like the egg yolks, I don't think that they've been turned into little devils, but I don't think they are as bad as people make them out to be. It's more when they become processed and refined and in large quantities as well. It's one of our nutritionists recommends a thumb-sized piece of fat with your main meal, of natural fats as well. So this discussion gets really, there are so many nuances and sides to the whole. There's a whole story of it, and this whole shifting dynamic, a shifting kind of perspective on fats that's happening at the moment, just like with bone health. And I think in the next 5 to 10 years, it is going to be very different, where it's not so much the fats that are the evils and the carbohydrates are okay. It's almost kind of flipping. And so the closest they can be to the natural form, minimum amount, but a little bit with every meal. The way that we kind of structure our meals for our men is a fist-sized serving of protein, carbohydrates depending on what type of activity you're doing, and then a thumb-sized piece of fat with the meal.
Oh, that's good, because that gives them a visual. Yeah, I say, of course, you got to avoid seed oils, hydrogenated oils, and that's actually much more mainstream now, especially with dementia, and because they're inflammatory, and we're really trying to reduce inflammation, which osteoporosis is becoming to be known as an inflammatory disease. So then we might actually be shifting the mindset in conventional medicine when we start to really think of osteoporosis as an inflammatory disease. I tell people to eat coconut, olive, and avocado oil and butter.
Yes.
So I do say butter, but of course.
Okay, great. I was afraid to say that, Debbie. But I would say that's how I live my life as well. And it's not, you're not doing it in large amounts, small amounts, but those, what you just said, yes, brilliant. I 100% agree. And the seed oils, they're the ones we want to stay away from, the processed ones.
Say it. Don't use your platform, use your voice. People need to hear this. They're at home. They have not walked this walk or learned what it is you're learning and doing what you're doing. And it's not just you were the N of one, right? You worked on you, but then you're doing it with others and you have a program. And so you're seeing that. And that is
Yeah.
becoming more mainstream knowledge about fats and what we have to avoid. So those are your pillars. Your pillars are nutrition, right exercise. And the last one you said was
Removing the obstacles to bone growth. And that's more around the causes and the medical conditions and also inflammatory conditions that might be essentially working against us. It's like when you have a dam, when you have the big Hoover Dam, and there's water coming through there, and they're trying to fill it up, but there are these gaps that are emptying the dam. And if we're trying to fill up our bone mineral density, as in we're trying to fill up that dam and that strength, but there's always these little holes letting out the strength and the good structure, then we're going to be working our butts off to try and strengthen things, but it's just going to work against us. So we need to plug those holes so that we can strengthen those bones.
Yeah, stop the loss. Okay, why don't you describe, I know you've been talking a lot about your programs. I just want to hear what, in a nutshell,
Yep.
your program and what you've been noticing. Like, what are the achievements? What is it? What are the things that make you say, yes, I'm doing the right thing? What are the comments you've heard from men? What are the things like we hear your story, but
Yep.
I want to know like kind of the structure. You just told us the structure of your program, right? The three
Yep.
areas you focus on, but you have a team. Are you virtual? Where are you located? Can they work with you anywhere? How do people find you? And then some of those success stories.
Okay, great. So it's all online. We work with men from all over the world, so you can be anywhere with the internet connection. It goes for 8 weeks. And we run through a series of lessons, the recorded lessons, but also live workshops. We have an exercise physiologist who is an accredited university-trained professional working with exercise to help treat different conditions. Essentially, that's probably a great way to sum that up. And she talks about the right kinds of exercise and customizing a plan for the gentleman. And we have a nutritionist who talks about just really basic, bring it down to the really simple things so that we can implement the right types of nutrition. We also have a mindset coach who makes sure that we can stick to things. And then I'm there as well doing Q&As, supporting our men in the Facebook group, answering questions. And we're creating, one of the things I get really excited about is that sense of camaraderie and support, because it is a bit of an isolating condition for men. I know it is for women as well, but particularly for men, we're kind of left out wondering, what do we do? Is there anyone else out here with this? And so the guys have really bonded and gotten to know each other. And that's kind of what we're emphasizing as well along the way. That's one of the main things that we've seen, but also there's a lot of information, but what do we do with that information? That's kind of what I think about. It's like, there are these studies, there's this information. What do I do? How do I, because this, for me, kind of became, it started off as kind of a selfish pursuit to try and treat myself. What do I need to do every single day to make this thing work? And then I kind of convert that to others. So what do I need to do to make this thing work? And that's been really exciting to see the guys getting active, seeing what their limitations are in a safe way, implementing, seeing that hope and that excitement, and being able to move forward in a way that is healthy for them, but also doesn't have them stuck feeling sorry for themselves, but rather excited to be making a change and to be improving their lives and to see a path and a shining beacon at the end of this tunnel. And to find us, you can go to our website, bonedensityeducation.com, or you can find us on YouTube, Bone Density Education as well. And yeah, we have a few different free resources, and we also run this program. And yeah, we'd love to help the gentleman get back on the right track, and find that silver lining and get back out there playing tennis or whatever they want to do.
Powerlifting.
If they're into that, I find that not as many guys want to do that. I seem to be the only one. I keep encouraging the guys to do it. They're like, no, tennis is good for me, or pickleball, or whatever they like to do. But they're all doing some kind of lifting, yeah, in the gym, which is fantastic.
And are there a couple of lines that you could think of, or people that you've worked with that like success stories, maybe something that someone said to you that really touched you or resonated with you?
Yeah, I was speaking to one gentleman yesterday, and I was asking him, what did he get out of the program? And it really was that camaraderie, that group's kind of support from other men, and to be able to move forward, and not be alone doing all of this. It was that, and also knowing what type of movement, what type of exercise is going to help. Because it's very easy to find gym workouts or things everywhere, but what do I need to do? What do I need to do step by step to make this thing happen? And so that's kind of, I haven't memorized the quotes, but those are the kind of general sentiments that we're getting at the moment.
Yeah, and that's great. I mean, that's like, wow, this is what you're doing in your life. This is what you're doing for others. I think that's really commendable.
Thank you. Thank you.
All right, Tom, this has been so informative. And when you reached out to me with males and osteoporosis, I was like, whoa. And I think mentioned this to you, that all of my writing is to women and to women, and everything I write is for women. And then this year, I actually had a man that approached me in one of my programs. I run functional labs. I run stool labs and look into the gut. And now when I'm doing my copy and ever I write women, I'm thinking, and so. And now you're making me think. Like, I don't know that I want to say people, because I think mostly who I work with is women. And honestly, I want to work mostly with women. I'm going to send the men to you. Although, of course, I'll work with the man if he wants to work with me. But yeah, so it's really important that we do this. And I want to go back to something you said in the beginning that is going to become probably my next podcast episode that I do by myself, is the disillusionment of medicine. You spoke about that's where you came to when you were in medical school, right? And I started to think, wow, disillusionment. Wait, I feel like I can't talk. Disillusionment, right? Is that what you say? That's a word.
Yeah, being disillusioned. Yeah.
So yeah, I know. I know it's
Yeah.
being disillusioned, but I
I,
want to put it in this. I wanted to put that. So
yeah.
disillusioned with the
Yeah.
illusion of bone health is what I just kind of went to when you were saying that. I thought, wow, the disillusion of what is the illusion we're disillusioned with. And the illusion is the way we're managing bone health. That it's fuzzy. We have to kind of break that apart. So I see that as something we're
Definitely.
doing.
Yeah.
Your work, my work.
I would say that my kind of thought on that with disillusionment. Thanks for clarifying that. I would say that it's thinking about it as a disease, because in my mind, a disease has a bug, has a virus, has a something we can attack, and once we remove that, things go back to normal. Yeah, you're back to them. And I don't think it's quite that. There might be causes, but it's also, like you said, you'll be saying throughout, that it's a whole system. It's a whole process. There's different components, different facets. And I think as bones deteriorate, we can also strengthen them. As muscles deteriorate, we can also strengthen them. And that's why I want to think of osteoporosis as a truly reversible condition, drug-free condition, rather than a disease. And I think once we start thinking of it as what it is and not labeling it, hopefully this helps with your kind of perspective on it. Maybe it doesn't, I don't know. But that's when we can start to become less disillusioned and potentially start seeing a path forward that is productive and is helpful and is drug-free.
Yeah, that disease, that label puts boundaries around it and
Mm.
quantifies it in a way that it shouldn't be, because it is so much more than that. First of all, we shouldn't be compared to our 30-year-old selves and expect that we would have the same bones that we had at age 30. And when we call it a disease, we're actually not thinking of all of the factors that go into it.
Mhm.
And like you said, because the word disease to you and in the training is that it was a bug, or it had less factors that could be managed with a pill or something, whereas there's so many areas that are going to contribute to bone loss when we come to those secondary causes. So
Mhm.
that's what I think happens when you label it as a disease. You kind of pigeonhole it and give it only a few potential reasons, whereas there are so many. And you know what? Most of those are in our control.
That's
We
right.
can change those. And that's what you do. It's that, to me, it's a lifestyle. My program, Healthy Gut, Healthy Bones, is to teach a lifestyle. And that's why I call my podcast Stronger Bones Lifestyle, because it isn't just one thing. It's all of the things every day. It's a shift in the way you were living with this awareness to how you need to live now that's going to support building stronger bones for the rest of your life.
That's right. And it's a fantastic lifestyle. It feels fantastic to be in that place, right? I don't see that there's any reason why not to. It's like you more energy, feeling better, having more fun. Yeah.
Yeah, and then
It's
you have that positive domino effect of everything else, right? Typically, you probably won't have as much stored energy on you. I don't call it fat, I call it stored energy. So you're not going to be, we all want to lose weight, or many of us do. So it's like, then you'll be, well, maybe women more so than men. So you've got that. You'll look better, you'll have more energy. So there's a lot of things that are going to come out of the right lifestyle when you're
Mhm.
focusing on your bone health that are going to actually be beneficial in many other ways.
That's right. Fantastic.
Oh, Tom, such a great conversation. Thanks for raising this awareness, sharing your message and your work with me, with the listeners, and with the world.
Thank
Thank
you
you.
for having me. And I really appreciate what you're doing, Debbie. It is really important work. And the message that you're spreading, the the guidance that you're providing, it's making a shift in so many lives, and I think it's going to have a big domino effect. And so I'm really glad that you brought me on, and I hope that the listeners get something out of this. And wishing everyone the best in their bone health journey.
Thanks for joining me on Stronger Bones Lifestyle. Are you ready to take charge of your future? For show notes, resources, and information on my programs, please visit DebbieRobinson.com. If today's episode empowered you, be sure to subscribe, leave a review, and share it with someone who needs it. Together, we're building stronger bones and stronger lives. Take care, and I'll see you in the next episode.